Child health is one of the United Nations' 8 core Millennium Development Goals. According to United Nations data, in low-income countries, 1 out of every 10 children die before the age of 5. In wealthier nations, this number is 1 out of 143. Specifically, by the year 2015, the United Nations seeks to reduce by 2/3 the under 5 mortality rate. The WFH shares this goal to improve child health and mortality. We have been working in parallel through the development programs of the World Federation. Unfortunately, mortality may be even worse for children born with hemophilia. Here you see the ratio of children to adults segmented by the economic capacity of countries. In this chart, children are in blue and adults are in red. WFH data suggests that as the economic capacity of a country decreases, the ratio of children to adults also decreases. Quite simply, in low-income countries, children with hemophilia are not surviving into adulthood. However, there is evident reason for hope that this reality can be changed. Since 2002, significant progress in improving mortality has been made among the global hemophilia population. In 2002, the WFH announced a global development program, the Global Alliance for Progress, also known as GAP. One of GAP's 3 core development objectives is to close the gap between the number of children born with hemophilia and the number that reach adulthood. An analysis of data conducted since the GAP launch demonstrates an improvement in mortality for patients with hemophilia. WFH programs have played an important role in improving care delivery in this period. Once again in this graph, the children are in blue and the adults are in red. Comparing similar data from 2002 to 2008, it is quite evident that today, in part because of the work of the WFH and our interventions and development programs, that more children are surviving into adulthood. Given these findings, the WFH has begun collecting even more detailed data so that we can do a more powerful analysis of these numbers. The rise in the number of adults with hemophilia undoubtedly results from the number of children aged 12 to 18, those within the 6-year time span between 2002 and 2008 that have now reached adulthood. So let's go even further and look at 2 individual countries, Georgia and the Philippines. Both were 2 of the first countries in the GAP project, officially launched in 2003. Let's compare the countries. In Georgia, which has a GDP of $4,500 per capita, looking at the baseline GAP year through 2008, the IU per capita of factor concentrates increased 2,400%. In the Philippines, with a GDP of $3,300 per capita, although here the IU per capita increased 50%, in actual growth, it was only a slight increase, and the level remains well below the optimal minimum of 1 IU per capita. However, this really doesn't tell the whole story, so let's look at the results in the terms of mortality. When looking at these countries, the results are equally impressive to the global numbers and validate the WFH development model. Here you see significant progress in mortality is evident in both countries despite their differences. As before, the children are in blue and adults are shown in red. It is noteworthy that the improvement in mortality is not exclusively dependent upon an increase in the availability of clotting factor concentrates, or that the economic capacity of a country does not necessarily correlate with the potential for improvement. In spite of these obstacles, clearly, other factors contributed to the remarkable turnaround and advances in mortality within the Philippines. One reasonable conclusion is that the intensive development work of the WFH and our national member organization, working with their local healthcare professionals within the framework of the Global Alliance for Progress, has contributed to an improved and sustainable outcome. And perhaps most notably, it is the educational and psychosocial support of patients and their families, the better organization of care, and the training of a multidisciplinary healthcare team that led to the mortality independent of an increase in clotting factor concentrates. Those in sub-Saharan Africa and other economically disadvantaged regions of the world should gain hope from the significant improvements in mortality that you have seen here, despite the low level of clotting factor concentrates. Although factor concentrates are certainly life-saving and essential to achieve a quality of life equivalent to those living in developed countries, treatment for all really means so much more than simply access to product. These results demonstrate that we should not narrowly define treatment for all as being synonymous with access to factor concentrates. To sustain and build upon the WFH successes, we must also cultivate and integrate youth into the work of the WFH and our national members. The first 3 years of the WFH strategic plan focused on building our global family to include von Willebrand disease, the rare factor deficiencies, and those living with inherited platelet disorders. While we will continue this work, the WFH is now looking to expand our youth programs to ensure that a future generation is ready to assume the mantle of leadership both globally as well as within the national organizations. WFH programs are evolving to incorporate an integrated approach to youth leadership, including expanded youth fellowships, youth opportunities within the WFH training programs such as the Twinning program, and a number of youth-specific publications. We are modernizing the way in which we communicate and utilizing the latest social media technology to reach out to the next generation in the language in which they communicate. We are now using social media forums such as Facebook, LinkedIn, Twitter, and YouTube. So we encourage you, become a fan, follow us, watch us on the internet. You know, we can also have fun while we learn as well. And so the WFH has been working on some other programs. Let me give you just 2 recent examples. Journey Around the World. Journey Around the World is an innovative game for children attending summer camps to raise their awareness of the needs of people with hemophilia in developing countries. In 2009, this program was piloted in 26 U.S. summer camps. Journey Around the World engages youth in more developed countries to give back to the global community, as well as to recognize the importance of continuing to advocate for sustaining care within their own countries. During this game, campers learn about other countries. They're broken into groups, they're given a passport and an itinerary, and over the course of the evening on their journey, they visit different countries to learn about the country, as well as to learn about what the care of hemophilia is like within that country. Another example, suitable for even younger children, uses the universal language of pictures. Children around the world can learn about hemophilia in a fun, easy to understand, and interactive way. The Hemo Action Cards are a tool to teach children how to prevent bleeds and manage hemophilia by playing at the same time they're learning about the clotting process, the types of bleeds, and suitable physical activities. Later this year, we will make this game available on the internet, and it will be our first electronic game. You know, a big part of what inspires me to volunteer with the World Federation is, in fact, the next generation, those that will come behind us. Can we leave a better world for the future? And certainly, not the least of which is my great-nephew. He was born just over a year ago, also with severe hemophilia. You see him here celebrating his birthday last month. What a remarkably different world he enters today than when I was born 50 years ago. Preparing the next generation for the future will require our support. Through enhanced youth education, awareness, and engagement, we will assure continuity within the WFH and our national members. We will build a greater unity among our global family, and perhaps most importantly, we will capture the energy and the innovative ideas that this generation has to offer.